let's do some high yield pediatric NCLEX review because I have an upcoming pediatric exam, and it just happened that our first exam was all about like growth and development and the stages, and our second exam was on literally all systems within pediatrics. Okay, let's talk respiratory first. So big things with respiratory that are tested on the NCLEX and also things I need to study. Croup is a barking cough and you treat with humidified air. Epiglottitis is presented with drooling, and tripod, which is that like hunched over positioning. Do not assess the throat. Don't stick anything in the mouth. You're worried about airway because ABCs, airway, breathing, circulation. Bronchiolitis or RSV, there's wheezing. You're going to be suctioning a lot for this condition. Asthma, you want to prioritize rescue versus maintenance meds. So your rescue meds are like your albuterol versus your maintenance meds are like steroids and things like that. Cardiac high yield things, tetralogy of Fallot. To help treat that, you do the knee to chest position with infants and children. Kawasaki's disease is the crash and burn, and so you can look up that acronym. I don't know it off the top of my head right now, but strawberry tongue is one of them, and you're going to treat it with IVIG. Okay, I looked up crash and burn because I felt like a bad person if I didn't know it. So it's conjunctivitis, rash, adenopathy, strawberry tongue, hands and feet swelling, and burn, which is the fever for greater than 5 days. And that's what crash and burn with Kawasaki's disease stands for. Okay, GI disorders, common ones are pyloric stenosis, which prevents with projectile vomiting. So if you have a patient that's projectile vomiting, think pyloric stenosis. Intussusception is current jelly stool as the main presentation. And Hirschsprung's disease is where there's usually no meconium within the first 48 hours of life. So those are how those three present. Know that. Okay, common neuro things to know are seizures. You're going to do safety first, so turning someone on the side, making sure to stick nothing in the mouth, don't put anything hard in the mouth. And then meningitis, which you want isolation precautions before you do anything else because you're worried about spread. And that has like nuchal rigidity or like painful turning of head positions, and you want to keep the head basically like neutral. You want to decrease ICP, so have like a calm environment. If somebody has increased ICP, you want a quiet environment with low stimulation. Big endocrine and metabolic things are type 1 diabetes, which hopefully you know a lot about from MedSurg, but if you don't know, it is where the pancreas does not produce insulin, and so you have to give insulin. Big things with this are knowing and recognizing the signs of hypoglycemia and giving glucose when those signs present, and then also DKA, which are polyuria, polyphagia, and polydipsia, which like is excessive hunger, excessive thirst, and excessive urination. Be thinking diabetes. And then diabetic ketoacidosis, you have ketones in your urine. This is bad. PKU is another common condition, which is treated with a low phenylalanine diet, which is like proteins, eggs, legumes, things like that. So it's like a low protein diet for people with PKU, and they have to take some substances. Gosh, I'm struggling. With pediatrics on the NCLEX, you still want to focus on your ABC, so your airway, breathing, and circulation. Really focus on the fact that all care is family-centered and oriented, so you want not only the parents involved in care, but also the children, and to make sure that you do things that are appropriate for the child's age. Pediatric medications, you want to remember weight-based dosing, which is milligrams per kilograms. Safe administration, some common things to do is with digoxin, which is a heart medication that increases the heart's contractility. I remember this because I think about the heart digging for a good contraction like digoxin. And you want to check the apical pulse before you give this medication to make sure that the heart rate isn't too low. And then the antidote for digoxin is called Digibind. And then you want to never give aspirin to children under the age of 12 because of Ray's syndrome. That's some very quick overview on some high yield pediatric NCLEX questions that you may or may not see and things that I needed to study for my exam. I hope this helped. If you like this video, please like and give a comment. Thanks. Bye.